How did Agent Orange exposure affect Vietnamese citizens long-term? Imagine living in a place where the air, soil, and water are contaminated for decades. That's what many Vietnamese citizens faced after the use of Agent Orange during the Vietnam War. This herbicide, used to clear forests and crops, contained a deadly chemical called dioxin. Dioxin is incredibly stable and can stay in the environment for over 100 years. It builds up in the fatty tissues of people and animals, passing from mothers to their children through breast milk. This means that even people born long after the spraying stopped are still affected. In the years following the war, many Vietnamese experienced serious health problems. They developed cancers, skin diseases, and respiratory issues. Experts estimate that around 400,000 deaths have been linked to illnesses caused by Agent Orange. The chemical has also been connected to heart disease, diabetes, and nervous system disorders. Children born to parents who were exposed often have birth defects like spina bifida or other congenital malformations. These defects can be passed down through generations, making the impact even more widespread. Neurological damage is another long-term effect. Dioxin acts as a neurotoxin, harming brain tissue and leading to early signs of dementia and other nervous system diseases. Even decades after the war ended, studies show elevated levels of dioxin in the blood of people living near former spray sites and military bases. This ongoing contamination means that exposure continues, affecting new generations. The societal and political effects are also significant. Many Vietnamese veterans and civilians demand recognition and healthcare support for the suffering caused by Agent Orange. The challenge lies in proving exact exposure levels and cleaning up contaminated areas, which is difficult and costly. The persistence of dioxin in the environment complicates efforts to reduce health risks. Overall, the long-term effects of Agent Orange on Vietnamese citizens are heartbreaking. Widespread illnesses, birth defects, neurological problems, and environmental contamination continue to impact lives long after the chemical was first used. The legacy of this chemical remains a major concern for health, justice, and environmental recovery in Vietnam.